Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. A lot's been happening the first month of the new year with respect to the Congress and the administrative agencies that oversee the Medicare program and other orthotic and prosthetic healthcare programs. First off, the State of the Union address is impending any moment now, and ultimately we'll learn a lot from what the President intends to propose with respect to healthcare and other issues related to O&P, perhaps. He may not propose very much. The next important milestone is the budget, where the President will release his federal budget proposals for fiscal year 2020, and that was expected the first Tuesday in February, but because of the government shutdown will be delayed. We don't know exactly when that will occur, when that document will be available, but as soon as it is, we'll learn a lot more about what the President and the Department of Health and Human Services intends to propose in the area of Medicare, Medicaid, impacting orthotics and prosthetics. While that occurs, we wanted to make sure that you are aware that as we took stock of what occurred last year with respect to the Orthotic and Prosthetic Medicare Improvement Act, we are now moving forward with a renewed effort to try to reintroduce legislation in the House and Senate in a bipartisan fashion to try to advance the orthotic and prosthetic agenda. And the NAAOP met with AOPA and its consultants. We're consulting with the O&P Alliance organizations, trying to refine the legislation and to figure out what our next steps are. So first off, the very good news is that last year saw the passage of the clinical notes provision, recognizing the importance of orthotists and prosthetists' clinical notes as part of the medical record of the patient for purposes of determining medical necessity. That was a huge victory, where it was part of the O&P Medicare Improvement Act, just one section. But the fact that that passed was a real shot in the arm to the O&P field, and a major advance that we continue to reap the benefits of in many different ways. The next provision we worked on really unbelievably hard over the course of the year, and AOPA really took the lead on this. In particular, Tom Feist, the executive director of AOPA at the time, was just a stalwart in trying to get through this provision. And ultimately, it would have redefined off-the-shelf orthotics to restore congressional intent by returning to the legislative language rather than the regulatory definition of what an orthotic, an off-the-shelf orthotic is described by. The term is minimal self-adjustment in the statute, but the regulatory process wrote that word out of the statute and expanded considerably what OTS orthotics would be considered, and thereby exposed a tremendous amount of orthotic devices to competitive bidding. CMS just announced in December that they're planning to move forward with competitive bidding of 24 orthotic codes. We believe 22 of those codes are custom fit codes. They're not off-the-shelf codes. And yet they do plan thus far on proceeding with that. We're trying to get them to change their mind. In the meantime, we are interested in trying to figure out ways to enhance the legislation before it's reintroduced and to streamline the bill to make it a bit more understandable and a little less complex, and we'll be working on that over the next several weeks in cooperation with AOPA in preparation for the AOPA Policy Forum scheduled for later this spring. So, a brief summary of where we are, where we stand, and we're looking forward to a new and very eventful year. Thank you.